There we go.
Yay!
We got it to work.
There we go.
All right. Congrats to us.
Yeah.
My chair sounded like it farted. It's okay. All righty. We are finally online. Sorry we're a little bit late. We were, as always, having technological issues every time. My phone is charged. The Wi-Fi is on.
We're just
That's
late.
it. And then we hit the live button, and then the thing didn't happen that's supposed to happen when you hit the live button. So,
Yep.
But here we are. Look at this. We're all here together. Look, our sister's on there.
Who is?
Candy, our sister.
Oh.
And then my South African sister. Look at that. Oh, I will say that my sister-in-law, Erica, her family in South Africa set their alarms for 1 a.m. when this is going off, or 1:30.
Yeah?
Set their alarm for South African, well, in South African time. And they watch us live. How great is that?
fun.
Yes. I'm not going to tell them they can watch it later. But so if they're there, a shout out to them. We'll kind of watch for them. So super fun stuff. All right. Good times. Well, we're just going to give it a little bit more time until we get everybody on here. I saw, I know two Dodies in my life, my brother, and then Dodie Welshier, who is our lobbyist for the Kansas Academy of Family Physicians in Topeka, and she's on here. So looky there. One Dodie loves me more than the other. It's the lobbyist.
I was going to say. That was my guess.
So shout out to all the Dodies out there. All right, well, we're going to go ahead and get started. And as always, we will introduce ourselves. My name's Jen Bacani McKinney, and I'm the Wilson County Health Officer.
And I'm Destiny Wheeler, and I'm the Wilson County Health Department Administrator.
All right, so we are going to start off with some statistics. Yay! Okay, there you go, Des.
All right.
US ones and Kansas.
So,
And they're just updated every Monday, Wednesday, Friday, so these are Monday's numbers.
yes, yeah. So in the national numbers, total cases as of Monday was 1,467,065, sorry. Small. And with 88,709 deaths and 55 states reporting numbers, so everyone. And in Kansas, the most recent numbers, we have 8,340 cases and 173 deaths. So,
All righty. And how about Wilson County?
oh, Wilson County still, well, we've still had one confirmed case. They have recovered, and we are standing steady at 0 since then.
And as a reminder, please feel free to ask questions. Today was a big day, and so that's the biggest news. The big news is that the governor, at her press conference today at 1:30, she informed us that we are actually moving from phase 1.5, which we are in right now, to phase 2 as of this Friday, May 22nd. And so we're moving forward. I think the government is doing a good job of analyzing the numbers day by day, so it's not that we have to stick with one plan and just go with it forever because that's what we said. We need to look at the data and make sure that that's the right thing for Kansas. I believe today she announced that they have a task force. It has a really Spark. It's like
Spark,
a fancy name.
yeah.
Something about reopening Kansas at the end.
Revitalizing Kansas.
Revitalizing. Anyways,
I don't remember.
you have to have a catchy name, right?
Right. Yeah,
Kinda cool.
Spark was a good
Spark
one.
is a good name. So she said on her task force she has many public health and we have elected leaders. We have economists as well, because I do believe that she is taking it very seriously about how we need to reopen our economy. As we always say, we know that this whole pandemic is not just a physical thing. We know that it is being a challenge to people mentally. We know that it is a financial challenge to people and our economy as a whole in Kansas, in the nation, in the world. So we know that we're affected in so many ways. So it was very good to hear that we're attacking this problem from multiple directions on that task force. Looks like we might have some questions already.
We do.
Oh, and then we'll talk more about what phase 2, the new phase 2, because it's not exactly what phase 2 looked like a few weeks ago. So we'll talk about what the new phase 2 looks like in Kansas, and then it's not much different than the original phase 2, but we'll tell you what it looks like compared to phase 1.5.
Yes.
Right? Okay.
Yeah. Okay. So why are casinos being allowed to open but not swimming pools? I am not in the room when they make the decisions, and they have not explained that decision. My guess would be that people can stay apart from one another more easily in casinos. That's my guess. So like in a swimming pool, it's going to be mainly kids, and they're going to be thrashing around. Kids are kids. They climb on each other in the pool. We always did. And that's my guess. I don't have a accurate answer.
And I know people, I have seen that question from Dr. Vaughn earlier. She asked if we could get some more information from the state. We're always happy to get more information, because we always will admit when we don't know the answer to something. Like Destiny said, unfortunately, they don't consult us. We'd like them to. We've offered. It's all right. But we will be happy to get more information. It's been suggested, is it because of money or whatever? There are so many sides of this, where we also get the argument that the Kansas economy is losing money. So then does something like that help the economy? I don't know. There's so many sides of it. So I do ask for everybody's, again, grace and respect with each other to assume the best. We know the world is not perfect. There's been a lot of talk of politics and as it pertains to the data and all that stuff. We know the world isn't perfect, but we always want to assume the best in everybody. But at the same time, we will get information, and we will try to give you the best answers possible. So thank you.
How accurate is antibody testing, and when is it available in this area?
So antibodies, it's such a hot topic these days, right? So it's so trendy these days, antibodies. Like PCR is so yesterday. PCR is the nasal swab thing. And again, always have to use this gesture for some weird reason.
Always the nasal swab.
So antibody testing is where we do a blood draw, and it's not a nasal swab, a blood draw to see if your body has created antibodies, which are little proteins that react to a trigger. In this case, the virus SARS-CoV-2, which is the coronavirus, COVID-19 virus. So antibodies, it's a tricky subject, because the tests right now are not what we would call accurate for being able to give you a definitive answer. So like if Destiny gets her blood drawn and it says that she has antibodies to coronavirus, the problem with that is that we don't know what that means exactly, because was she exposed to another coronavirus? Because coronavirus is a whole family. So was she exposed to SARS-CoV-2, or was she exposed to coronavirus, another type of coronavirus in the past? Lots of the coronaviruses just cause a common cold. That's what we were familiar with before. Or we don't know if that means, okay, now that she has antibodies, does that mean she's immune to COVID-19? And we don't know that answer either, because we don't know how much of the antibodies you need, how long those antibodies are there, like how long they stick around. We don't know if people are actually building antibodies to this virus. Like if you think, for example, HIV. If somebody's exposed to HIV, they don't create antibodies to that virus. So we still have to treat that. So there's all kinds of questions out there. It is available in various places in Kansas, not in Wilson County right now. The state is saying if you do antibody testing, you have to know all the information that goes with it, and you have to inform patients who get it done of what that could mean and what it might not mean. So we don't want to give people false hope. The most dangerous thing right now about antibody testing is that we could give people false hope that they are, or false information that they are immune, and then they go out and infect others or get infected themselves, and it could be really bad.
Yeah, and I am really excited for the antibody testing to be narrowed down and to be more accurate, because it will give us a more accurate picture of how much of the virus has been in our communities and in our country. And so I'm really excited for it, because from like kind of a numbers nerd type of
Nerds. You're dealing with nerds.
Yeah, I want to know. Like, I want to know how many people have had it and how good our systems were, and we're always looking forward to the next thing. So when the testing is good enough and it's available,
it's going to be a huge tool for us.
It's huge for pandemic response in the future, and yeah, I'm really excited about it. But right now we're not encouraging it because it's just not accurate numbers.
Yes. We also have been informed that there are, in fact, 2 Dodies watching. This is amazing. This is like where the apocalypse happens. The worlds are combining. Okay. All right then.
Are playgrounds opening in phase 2? I can't remember.
Playgrounds, I think they were still phase 3.
Okay.
We have to look back.
We brought everyone's plan but our own.
Yes, we will check it out. But we do, public spaces are open.
Yes.
I think originally when it was phase 1, phase 2, phase 3, I think we had playgrounds open in phase 3 actually. I'm sorry, playground equipment. Sorry. All playgrounds, public spaces in Wilson County are open right now, and we encourage you to use them. But it's just a little tricky with children all smushed together, germy hands, snot and stuff like that, getting on the playground equipment, and we don't have the capabilities as small communities to be able to clean up after all of them. So,
What antibody test would you use?
which antibody test would you use? Thanks, Dr. Holmes. Are you just quizzing me now? So Dr. Holmes is one of our health officers out in Dickinson County. So we are actually talking mostly about IgG at this point.
Yeah.
IgM. See, now we got straight up nerd stuff going. So IgM is the antibody that goes up, should go up immediately when you're infected. And then IgG is the antibody that is created, which allows us to build immunity to an infection. And so that IgG is what we're studying more, because IgM is even more unknown as far as how quickly does it go up, how long does it last, what does it mean when we have it, does everybody produce it, yada yada yada. So IgG is what we're looking for.
Yep.
Alrighty. Okay. Okay. Let's talk about the difference between phase 1.5 and phase 2. So Tuesday compared to Friday. What does that mean for us, Destiny?
It means
lots of things.
Mass gatherings go from 10 to 15 for phase 2, this new modified phase 2. So we're starting on Friday. Mass gatherings go from 10 to 15. Sports practices can happen now, as they were not allowed in phase 1.5, but now they are. Bars and nightclubs still cannot open in phase 2. Now, I've seen a lot of kind of back and forth. Bars that are restaurants, they can open.
So if they have a license to sell food, then they can be open. And that's what we have in Wilson County. We don't have any single bars, or not like bars for singles, but like bars that are just bars.
Singles bars. No, but we don't have any nightclubs or anything like that are just serving drinks.
If you want to create one, open one up, I think everybody will be open to it like in about a year. So
yeah.
Do it.
Wait till phase 3.
Yeah, wait.
We're still not going to be able to do parades, festivals, big community events like that. There are a few things that they're allowing in phase 2 that are
Bigger?
different. Like dirt track racing.
Oh.
But we don't have to worry about that. But
and it's outdoors.
It's outdoors.
And it should be one person on a dirt bike, right? I have never myself.
Well, I think they're
like
dirt track.
Oh, like
dirt
where
tracks
people are
like
racing
cars,
each other?
Yeah, and people sit in this. Anyway, we don't have to worry about that because we
Okay.
don't have that. So, yeah. Those personal classes or
yes.
like fitness classes at the gyms, they can start up, but they do have to adhere to mass gatherings, so it has to be under 15 people. So taekwondo, dance.
Piano is pretty individual.
Yeah,
but,
that's pretty individual.
Fitness classes?
Fitness classes like Zumba or yoga or something, those can open.
Karen says, so like Dad's tractor pulls? Sure, Karen. Not really. I don't actually know about that one.
I don't know
Oh, because I think that's going to be a good like like a big festival? Or
so I'm really happy we don't have dirt track races because that decision did not make a lot of sense to me. I don't know.
Yeah, that's weird.
I don't know.
Yeah, they didn't ask us about that one.
They didn't know. That.
As you're looking through that.
Oh, graduations. The governor's been very specifically she's very specifically made graduations their own thing. They're not considered a community event. They're not considered like a parade or festival or anything like that. They do have to adhere to mass gathering guidelines. So if you have a graduating class of less than 15, you can have everyone together.
Congrats, Altoona. Just kidding.
But
we can
if
say
not,
that because
we love Altoona.
We love Altoona.
Mm-hmm. But if you did you cough?
I did cough, but I coughed in my arm. That's all right.
But a lot of places are wanting to do drive-through, or I know that I'm pretty sure that our schools that have more than 15 graduating are postponing those until later in the summer.
Yeah, I know. Like Fredonia is waiting until August.
I haven't heard on Neodesha.
They're gonna do an outdoor one. So if anybody knows anything about Neodesha at this point, or Altoona really, let us know and feel free to mention it in the comments.
Yeah, and Kim, tractor pull in July. We hope.
Hopefully. We want to have the fair.
Yeah,
but we are anxiously awaiting to see what that looks like in the future.
Yeah, and we want to have like the endless foot drag, and we want to have the fair, and we want to have sausage fest, and we want to have all these fun things that we do at the end of the summer and into the fall. So we need to be good now and go along with the steps and the rules so that we can have those feasibly.
And our DJ from Sausage Fest actually says we have to have Sausage Fest. So thanks, DJ Joe.
DJ Joe.
All right. But yeah, so I think the main thing is just making sure that we are able to keep moving forward in these phases. And I think this is really encouraging that we're able to move to phase 2 quicker than what was expected originally. So we will just continue to try to keep everybody informed. The biggest thing probably right now is moving from 10 people to 15 people. It doesn't sound like much, but for our daycare classes, that could be a little bit more. For graduations or for any type of thing that we are, that we would like to do during the summer, even practices and stuff and classes. That's a big step for us. So we're really happy to hear that.
Yeah, and another thing that moving to phase 2 more quickly does for us is let us move to phase 3 more quickly, which is moved from July 15th to July 8th. So that moved up a week. Yeah. So.
And Dr. Newkirk in Neodesha says that graduation is August 1st. I think that's the same as ours.
I think so too. Perfect.
Right.
Thank you, Dr. Newkirk.
Look at this. Facebook Live. We're just solving the world's problems, I tell you. So good. All right. And so yeah, I think probably, I think, what was I going to say? Oh, about the rec sports. That was one of the biggest things that was hitting us for phase 1.5 versus 2. So we're happy that that's going to be able to happen. And so overall, I think for Wilson County, what we have kind of the summary is pretty much everything that wants to be open will be open, or is already open, or will be able to start as far as rec sports and things like that.
Yeah, the pool, it's going to push the pool out another week from what they were planning. And I know in Fredonia they were planning on
June 1st, I think.
June 1st, and I think Neodesha was planning on this weekend.
Like Memorial Day.
Yeah. So that's going to push them out a couple more weeks. And I've not spoken with the Neodesha's rec board, but Fredonia's had us come to their meeting, and they really are trying to take every precaution to make that
And I did
safely.
speak to the Neodesha rec
Oh,
board.
did you?
Yeah, this
Awesome.
weekend. And I mean, really, people are, we keep saying this every time, but everybody's doing such a great job of communicating and making plans together versus let's try to do this and see what happens, or we don't care about the rules, yada yada. So I think in general, most people are trying to figure things out together so we can open things safely and just keep them open.
Yeah. We don't want to backtrack.
We don't want to backtrack. Definitely. Okay, let's see what else we have. one of the topics, and yesterday, so every Monday, we've talked about this before, every Monday we have our countywide meeting that includes the schools and the governments and some businesses and churches and the hospitals, both of the hospitals in Wilson County, as well as people from the different clinics, medical clinics and dental clinics, the pharmacies. So yesterday we actually were joined by Representative or Congressman Watkins, Steve Watkins. So he joined us on the Zoom meeting, and we were able to get his take on things. So people are taking interest in our rural communities, which is very exciting. So we were able to ask him some questions, and if you do have questions for him, we actually have access to him. If you want us to pass anything along, we'll be happy to do that too. One of the things we talked about yesterday was the idea of herd immunity, and I just want to kind of go over that because I think that's a lot of what people are hearing, or maybe it was already heard. Herd immunity.
No.
Dad jokes. Okay. Public health jokes. I just need to see some laughy emojis whenever you get a chance to just click that little button.
Don't encourage
Do
her.
it. Do it.
Don't
okay.
encourage
So
her.
herd immunity. So what we know about herd immunity is really what it is the idea that enough people in a population, like in a community or a county or whatever, enough people will be infected that it protects people from getting the disease or prevents them from getting it in the first place. The hard part with COVID-19 is that we don't know, excuse me, oh man, a cough and a sneeze. I promise. I did take my allergy medicine today, though. But the hard thing with COVID-19 is that we don't know what that number is at this point. So the more contagious the disease, the higher the herd immunity would need to be. So current studies, and again, the current studies don't know either, right? But our best guesses right now is that 50 to 90% of the population would have to be infected before we get to herd immunity levels. That's a big range too. We get that. That's it's either it's anywhere from 0 to 100%. Just kidding. 50 to 90%. And so, thank you, Annette, for the bless you. So in that amount of time, for 50 to 90% of people to get infected, we will see a lot of deaths. And again, we're hoping that the numbers are not as bad as what we think. We are already seeing the predicted numbers of deaths to be lower. We're already seeing that case fatality rate that we've talked about, like how deadly the disease is. As we're doing more testing, we're seeing that number come down. It's still much higher than a lot of other diseases, but it's coming down a little bit. So we're still making our best guesses. For example, with the measles, it's because of its infectious rate, the ability to be contagious, you have to have 95% of the population be infected before herd immunity would happen. And that would be really bad, for that many people to get measles. So the reason why I want to tell you this is because as we are talking about herd immunity, it's not as easy as let's just see what happens, open up and see what happens and let a bunch of people get infected. Right now, in New York, they've got about, I think they said 13% of the population, and that's one of our big hotspots in the country. And so you can see that even there in our highest, the highest
infection
rated state, we still are not anywhere close to where we would need herd immunity. So just things to think about. We want to keep you guys educated because we know this information is going around, and we know these news stories are coming out, and we just want you to know what that means and what it would look like.
Yeah, and so on herd immunity, because I'm a big vaccine advocate, I'm gonna throw this out here.
Go for it.
We try to vaccinate at least 85% of kids. We want, the measles vaccine. We want the measles vaccine in at least 85% of kids, so that the kids that cannot get the vaccine, if they're allergic to a component of the vaccine or they've had a reaction to the vaccine, we want to keep them safe still. So if everyone around you has immunity, then the odds of it getting to you are much lower. So that's why we want those high numbers for immunizations. And immunizations are a much safer way to gain immunity from the vaccination rather than getting the wild virus, because vaccines are weakened or inactivated viruses, so your body reacts to them, but you don't get as sick. You might get a headache or a little fever or injection site reaction. But that's good. That's your immune system doing what it needs to do. So anyway, that's my little plug for vaccines.
Yeah,
so get
absolutely.
your kids vaccinated.
And as far as vaccines go, most vaccines take years to develop. And so we are anxiously awaiting that. There are what did we say, 200 vaccines or something that are being tested or researched right now. And it's so, they have to go through multiple phases to make sure that the vaccine itself, it may do what it needs to do, but it can't have worse side effects than the disease itself.
Yeah,
and
we don't want
super
that.
important. Yeah.
Yeah, and there is one vaccine that the FDA has approved for a phase 2 trial. So
That is exciting. Isn't
yeah, so they're getting there.
it? Awesome.
You want to?
Yeah, so assisted living, that was brought up. What does that mean? What does phase 2 mean for visitors to places like assisted living, even nursing homes? So as we all know, those are our most vulnerable population. That's where we've had some clusters within the state and within the country anyways. So they are kind of being treated at this point as, I would say, as the hospitals are and the clinics and all that. It's kind of a separate thing. You won't see in the governor's plan telling them what an assisted living should do or a nursing home should do, because they are getting guidance from Medicare, from their bigger facilities, and they're really doing a great job, especially ours in Wilson County. And so we hope that we can make some things happen where we can see visitors come in, but that might look different. It might be visiting outside with, with chairs that are farther apart, making sure that people are wearing masks, something like that. Visiting at windows. I know there was more of that going on before, but we're gonna keep working with them to see what we can do.
and they truly are adhering to the guidance that they are being given from, is it KDADS?
Yes, I think so. Right?
KDADS, Kansas Department of Aging and Disability.
Yes. Oh, wow. What up, everybody?
I got my acronym.
Virtual high five.
Acronym police right here. But they are really, really adhering tightly to the KDAD's guidance, because I know that everyone wants to see their loved ones in their facilities, and they love their residents, and they want to keep them safe. And so, did we go off?
Oh, it says lost you. Oh, can everyone else hear us right now? Give us a thumbs up or a clicky if you. Okay, I see it. A little clicky. A heart? Will that work? Okay, we'll keep going unless anybody else tells us otherwise.
Yep. But yeah, so they are adhering really tightly. They're kind of just letting. Okay, there we go.
There you go.
They're kind of letting us know what they're doing at this point. We're not forcing. We're not like impressing something on them.
They're another group that has been communicating really well.
Yeah, they have been.
We also know, and we're fully aware of this, and they are as well, that this whole not having visitors is really tough on them. And so we don't want to downplay that either. We don't want to say, well, they're the highest risk, so we're just not going to have visitors forever. We get that part of their mental health is having visitors or being able to, congregate together even. So we just have to do that in a safe way.
Yes.
All right.
Earlier, Pat asked a question. Do math gatherings apply to only indoor events, or is it outdoor too? And it actually is both. Now, there are some caveats to that. Certain businesses and like community centers, if they are huge, they can also open in phase 2. But if they're like a great big community center and there's like a spot to play basketball and a spot to do this and a spot to do that, they can have 15 people in each spot, but they have to have enough room to make that happen. So say we're talking about the old Iron building as a community center, they probably don't have enough room to have very many 15-person groups.
Yeah.
So it really depends on how much space they have inside. Outside, it's still 15. But say in the case of say baseball started up and we're having games next Monday, their mass gathering limit is 15 still. But the way it has been explained by the governor's office and KDHE, if those groups of 15 are spaced out from one another, it's still a possibility to have them all in the same place, just not all together, if that makes any sense whatsoever.
Together, but like separated.
Together,
groups.
but separate.
Yes.
Yeah.
Separated groups.
So, you know, if you have a group of 14 and you go to the park, that doesn't mean only one other person can come to the park. It just means you guys need to try and distance yourself from other groups.
And especially even if those like 14, like, so yeah, even if those 14 people in that group are like not from the same household, we still would encourage people to try to do outdoor things that are that can allow people to not be smushed together. No trust falls or anything weird like that. That was always hard anyway. So
Yeah,
I don't know if anyone's doing those.
I don't trust anyone.
Never trust a virus. Yeah, hopefully that answers it. Do you want to? I don't know. What do you think?
There was a question about why bars can't be open when restaurants can, and
What was the other thing?
well, I can't remember the other thing that Danny mentioned. I don't know. My guess would be the lingering. People, when they go out to eat, tend to go, sit, eat, and leave. People at bars tend to linger longer, and they like to hang on each other a little bit more than you do at the normal, you know, dining out. That would be my guess. I don't know.
And we have one example actually that illustrates kind of what can happen if we're not extra careful. I was looking for that one again. Oh, bars, gathering up to because fitness centers. So
yeah, the fitness centers they are making
Separate,
sure everyone's keeping 6 foot distance.
So Danny, in your question, why can't bars open because when fitness centers can and stuff, like our fitness centers are taking out blocking off every other treadmill, things like that, so that people like literally like really shouldn't spend any time close together. You know, again, in theory, bars, people could do that. Like if you had chairs spaced out 6 feet and yada yada, it's just really difficult, especially if you start having a really good time and then you make poor decisions potentially. But I was just going to say we have one example in China where in Singapore I believe it was
The one guy that went to the clubs.
Yeah,
I think we talked about.
did we
him
talk
last week.
about that? Oh yeah. So yeah, where one person can lead to hundreds, if not thousands, of contact tracing, or you know, people that need to be quarantined, positive cases, things like that. And so that's a bar example. Not that bars are bad. We're just saying we have to be careful in every situation. That even though we're reopening, it doesn't mean just that we can't still be careful while we're doing it. Alrighty. You may have also heard that one of the treatments out there is remdesivir. It is it's a promising treatment, but what we're seeing is that it is decreasing the length of time that the patient has symptoms. It's not necessarily at this point showing that we're decreasing the mortality, meaning like the death rate, like in the people who are using it. Now, hopefully we'll see that. We continue to try it and see, but we did get 10 cases in Kansas, which would treat about 50 to 60 people in Kansas.
I think they got a shipment since then
good.
too.
Awesome.
Dr. Norman said that on his
good
thing yesterday.
Awesome.
They got more.
And then Governor Kelly is going to be talking with Trump tomorrow, President Trump, in the White House. And so she's going to be discussing the outbreaks in our meatpacking plants. She mentioned today that we are one of the only states that was able to kind of contain it in the meatpacking plants without having to shut them down. And so, because we've had outbreaks in meatpacking plants in many other states too. So that's exciting. We'll see what that interaction looks like. And it was really great. One of the reporters today asked her, how, like, you're a Democrat, he's a Republican, what's that going to look like? And she had just said, well, this isn't a political issue. This is a pandemic. We're going to try to discuss ways that we can work together and move forward. And I hope that is a message that's carried forward. So very, very good stuff. We'll see what happens there.
Yeah. Barbara asked when her quilt group can get together. They're a group of 6. I would say that, you can get together now. I would
just be careful.
don't sit on each other's laps,
yes.
but
and try to space out.
Yeah, odds are you'll be quilting, so you have, enough space between you. I would do it now.
Yep. Go for it.
Yeah.
Do you use like the pointy things? Like
no, that's knitting.
Oh. Oh, quilting, you don't have any sharp objects.
You have a needle.
You do? Oh,
Yeah, you
I'm
just
saying,
it's
like, I don't
sewing.
know how big the needle. I'm
She
not good
doesn't.
at this stuff. I'm learning so much on these things. All right. Let's see. Okay, you read that one and we'll see.
I heard that President Trump is taking some vaccine that's supposed to try and keep him from getting the virus.
So he did say in a statement that he is currently taking hydroxychloroquine. We also have a elected official from the state, Representative Marshall, who mentioned that he too was taking it. Right now, the scientific research shows that that is not a way to prevent getting the virus. It's not actually recommended to be given in anyone who's asymptomatic, and really the studies that are being done on hydroxychloroquine. While at first it was our most promising drug, we're still seeing that it maybe wasn't as promising as what we originally thought, and that's why we're kind of shifting our attention to things like remdesivir and other things. And you're not hearing as much about hydroxychloroquine. So yes, he came out and said that statement that he was taking hydroxychloroquine, and the science and research at this point does not recommend that you use that as a preventative treatment.
Oh.
All right.
Erica, ignore that.
Ignore that was your brother. What did you say?
What about fecal matter?
Can it be transmitted that way? So we can talk about wastewater, I guess.
We talked about wastewater
Yeah.
a little bit. It's not shown to be transmitted through fecal matter.
Yes.
Or urine,
Yes.
but it does actually pass through your body into the wastewater, and it doesn't survive in the wastewater. But in the future, that could be a good way for us to track viral load in the community. So.
All right. And Dodie, if you do decide that is something that you want to test out, please let us know. We won't visit for quite some time. Really a long, long time. So, okay. What else? Other questions that you guys might have?
I do want to say that hydroxychloroquine is not a vaccine.
Oh yeah, that's a great point.
It's a drug used to treat rheumatoid arthritis and malaria and other inflammatory diseases. So that's not
Great
a
point.
vaccine.
Yes, I left that part out. Last week, that was another thing. I printed things out in really, really tiny slides.
It's tiny.
Because I wanted to save paper. We're still saving trees through all this. So I will hold this like this. Last week, somebody asked about the pediatric multi-system inflammatory syndrome, which is potentially associated with COVID-19, and the state put out a alert about that. And so right now we are not seeing that in Kansas. The only states that they're seeing it for sure is in New York and Louisiana as of yesterday. And what it is, they mentioned that, whoever asked before mentioned that it's like Kawasaki's disease that we would see in kids. So it's basically an entire body inflammatory response. And so you might see something that looks like shock, where their blood pressure drops, and they might have a fever with all of this stuff. They might be dehydrated. They might need a lot of medications or IV fluids and things like that to be able to get their blood pressure up and to get them feeling better. So we don't know yet, is it only associated with COVID-19? In the people that they have diagnosed with this inflammatory syndrome, they did test positive for COVID-19. And we've seen this in other countries, especially in the United Kingdom, I think is one of the biggest places they're seeing it. So just lots of inflammatory responses going on in the body. They can see that through blood tests. And so we're still kind of anxiously awaiting that one as well. I don't think anyone can say awaiting without saying anxiously awaiting through this pandemic, because I've said it like 19 times. Mm-hmm. But it's just because there's so much information to be had out there. We're trying to process it all, and we're seeing what's coming next. Yeah, right? Like every week there's something new.
Yeah, they did say we haven't seen any cases of that in Kansas yet. Yep. So fingers crossed it doesn't get here.
Yeah.
So on your peanut butter challenge, what did your family vote for?
Our family voted for Peter Pan. Oh. Yes, but Facebook has spoken, and Jif was the clear winner in the Great Peanut Butter Challenge of 2020.
Yep.
All right, COVID-19 is important too. Okay, but yes, I posted that we ranked and guessed like peanut butters. It was a blind taste testing. Kind of fun. You should also come up with your own pandemic games.
Yeah.
There's a lot of time to do that. What other questions, you guys? Like we said, we always want to be helpful. We don't want to take up too much of your time, but we want to be available for you, and we will continue to do that. There was a question that came up actually through the week about if auctions were subject to mass gatherings. They are seen as an essential function in the state of Kansas, and so they can happen. They do not have to adhere to mass gathering guidelines, but they must adhere to social distancing guidelines. So people should wear masks. They are not being mandated at this point at auctions, but should wear masks because there are lots of people in close proximity, and they should also stay, if they are outside of or interacting with other cohorts, they should stay 6 feet apart from each other. And so please remember that. This is kind of auction season, and I know some have been pushed off. And so please do remember that that's something that we need to do to keep everybody safe. We're not trying to limit anybody's fun. If you want to buy that fridge out there, by golly, do it. But do it in a very, very safe way. All right. Let's see. Saw a story from Maine this morning that scam artists were texting people malicious links that said they were identified as a contact of someone who tested positive to click the link. How will you guys contact us in Wilson County if that happens so we can avoid scams? Dr. Newkirk will send you a text that says you've been identified. Just kidding. Just joking.
No. Okay, so if you have been identified as a contact, the health department will call you. Now, at the state, they're doing enhanced contact tracing. So you may get a call from a number from likely Topeka, 785 area code number. But they are also going to get a hold of us. So the health department's phone number is 378-4455. If that number comes across on your phone, please answer it. If you don't answer it, we will come to your house, so you know, and not because we want to come to your house and make you stay in there or anything, but we want you to know. So we will call you. If there are scams going around that we know about, I know that Fredonia's Chamber has done a really good job about putting that out. The health department puts that out if we know about it, like scams. Often we don't, but if we know about it, we'll put that out on Facebook. Yeah, that's pretty much. And when we're talking about contacts, remember that a contact of a contact is not a contact. That was one of our original things. Yeah, and it still stands. And we're still using it every day. We chant it to ourselves. Yes. So, and sometimes we have to we do that because we want to say, okay, if this person was positive, and you were this person. Or I'm sorry, but your friend was this person, and you're asking if you're in danger, or are you a contact because you're this person over here, so you're the contact of a contact. And so I don't know if these hand things work. How about this? If Jennifer tests positive, go on, tell her. I would be a contact because we spend an inordinate amount of time together. But my kids would not be a contact, because they're a contact of me, but not a contact of Jennifer. If you want to use real people rather than my hand puppets, well, you were kind of making it was kind of confusing. I'm just kidding. It's so much better the way Destiny said it. Thank goodness. See, Destiny is doing such a great job. All right, this is why we're a team, people. And contact tracing is really just so the difference between. Well, let me start with this. We made a suggestion in our plans that if you were going to open your restaurant, your hair salon, whatever, we recommend that people keep a record of who is there, because that's the difference. You actually made a great illustration of this, or mentioned this, I don't know if it was the other day, but just the difference between saying, knowing that Destiny, who tested positive, was at a restaurant at 6 p.m. on May 19th versus and then seeing who all was there at that time and contacting all of those people, versus saying, hey, if you ate at this restaurant
anytime on this day or maybe the day before or whatever, because I can't really remember when I was there, that will make so many more people.
It's so much scarier that way. And you know, I don't want to be like, hey, I'm going to use Rick's Place because they're not open till tomorrow. But hey, if you ate at Rick's Place on Monday and you know, you need to contact the health department
and that's our only way to
find
scarier,
people.
yeah.
And it is scarier. And it honestly, it kind of sheds a bad light on the restaurant because
when we don't want that to happen.
And we don't want people to be like, oh, I can't go. No, we want you to go. I am super excited that Rick's is opening back up tomorrow.
Yeah,
and I've had Thai food.
Yeah,
and I've had
so much good food here.
Everyone's opening. It's so nice. The food in Wilson County is amazing.
Yes,
but
all of you not from Wilson County should come visit. I mean,
not now.
Later, like at a different time. A different time. So, thanks Dodie and Rick and Bob for answering the farting question. I'll let you all just read that. All right. Any other questions? Anything else you can think of? Phase 2. So by the time we see you next, we will be in phase 2.
Which means we go to every other week.
Which means, we said we were going to start going to every other week on Facebook Live as of phase 2. So we will be on.
We'll be on next week,
but not
then
the following week.
Be on. And Jennifer won't be so busy next week, and so she'll make sure that the reminders get put on Facebook. It has been crazy.
It has been crazy.
It's been crazy day.
And we photoshopped our faces. Well, Laura Ratzliff did. So photoshopped our faces into many different duo characters, and we're really excited to send them out. And I cannot believe I didn't send a reminder today.
I know.
But I will. Don't worry. Maybe double for next week. Yay. All right. Hello from Ohio, Mary. So I just want to. Mary Dr. Krebs has been on here for a few of our sessions, and I just want to point out she's a family doctor in Ohio. I've mentioned her before, but she's amazing because she contracted COVID-19, and then kept doing telehealth visits from home while she was sick with COVID-19. Like amazing. She would be in bed. Basically roll over, do a visit, go back to bed or whatever. Mary, I don't know the whole story. I wasn't like stalking you, but we're watching you. But I mean, these are the people that are out there that are just amazing. And she's been on TV. She's been in the news about it because that's like truly, we talk about.
That's commitment.
Yeah.
That is being committed to your
Absolutely.
community.
So thank you for what you do, Mary. And we talk about heroes out there. I mean, we want to make sure that people know. I posted things about Clayton Romans who double and triple and quadruple cleans our exam rooms and leaves us nice little notes. We have the EMS people that are going into people's houses like every day and they don't know what's on the other side of the door. I mean, we have the business owners that are I know Brandon Tyndall, and I'm just throwing out things that I know of. Brandon Tyndall has a COVID czar at TCI. I mean, this is like cool stuff. People that are in charge of making sure people are safe, and everybody like these are heroes all throughout the world, and even right here in Wilson County, which is super cool. I think it's kind of fun. So. And Dr. Lewis, thank you, Diane. Dr. Lewis, who I had posted about, is another family doctor. He spent over a month in the hospital. Was intubated, has an amazing story, and now he's back to work.
He's back to work.
Yeah.
They released him, and now he's back to work.
Yeah, he's like, all right, here I go. Time to make the donuts. I mean, right? Like, this is just a thing. Like, this is the commitment that people have to make sure that people are safe. So that's why we kind of plead with people, wear your mask, do all the things. There are people that are doing... we ask a small thing like wear a mask, when there are people that are really out there doing heroes work. So cool stuff. Yes. Sorry, go ahead.
Laura Staker, I think, asked about garage sales, and garage sales are fine.
Yep.
You do have to adhere to mass gatherings. So
no more than 15
so
people
no
there
more
at a
than
time.
15 on this really, yeah. So
and then and social distancing, like spread out the really good stuff at the garage sale, so people don't go all together. But.
Yeah, and really, I mean, unless you're having like a multifamily garage sale at the Porter Building or something, 15 is not hard to stay under at a garage sale at any given point in time.
Yep. But as people have events, the people and this goes for and we'll ask of anybody like auctions or when the swimming pool opens, all that. The people who are opening up these entities are the ones responsible. So the garage sale people have to make sure that that there might be like hand sanitizer available, or that people are staying separated, that the tables aren't smushed together or whatever. So we trust people to do those things in the right way.
Yep.
Okay, we're seeing questions slow down, right?
Yep.
Okay,
Forgot
so
my watch this morning.
last
Look at
call.
this tan line.
Last call for questions. As always, thank you guys for everything that you're doing for protecting each other. Don't forget to check on other people, because it's a tough time for everyone.
It is. Yeah. If you have any questions, give us a call. We or send us a Facebook message. We're everywhere.
We're here. We're not going anywhere.
Nope.
We're
Nope.
around. So, and thank you guys for joining us. Like we said, we'll be back next Tuesday at 5:30, and then we'll go to every other week from there. And if you have questions in the meantime, please ask us, because odds are good somebody else has that question too.
Yep.
Any other inspiring words, Des?
See you next Tuesday.
Bye-bye.
Bye.